Today, in a combination of a remote patient monitoring and a care management program, we have over 10,000 patients that are participating. So from 50 to over 10,000, in 12 to 15 months is phenomenal when you think about the scalability. And they learn the patient and they develop personal relationships with the patients that also make that patient experience compelling. Patients have said to us on multiple times, this is easy, it's convenient, and that they will celebrate even better outcomes and partnerships with their physicians because they see that interconnectedness between the work that is happening in the office, but the care that we're trying to provide in the home space. And I would be remiss if I didn't acknowledge HealthSnap has truly been our partners. You talked about how Samson and I can converse back and forth. It really is because it is a partnership. They know us, we know them, and they've been able to flex and build a program that met our needs and, of course, our patients' needs.
That's some high praise, Samson.
Doesn't come lightly. We appreciate it, Angela.
He's worked hard for it, for sure.
We're going to lead to meaningfully medical improvements in patients' health and health outcomes. Oh, by the way, there's going to be financial ROI associated to that care delivery. So it's really easy to say there's reimbursement, but if you have no patient activation, low engagement, and patients don't perceive the value, they will just all churn off. And so driving a high retention, highly engaged patient population because they're actually giving value and outcomes drives everything else. And so for us, we've always put the patient at the center of everything we do. And more importantly, we've always taken an evidence-based approach to the way that we deliver these programs for all the patients around the country that participate in HealthSnap, in our RPM and or CCM program. We originally started the company out of academia, so everything we've done has been rooted in science and evidence. And now taking it one step further, even with, because we have Angela on the call especially, Prisma Health has really leaned into the fact that there are collaboration opportunities to put out research and publications in this field specifically when there's very little literature and evidence prior to the last several years. So we're leading the way in also publications and abstracts and research around the efficacy in RPM and CCM, which we feel like will inform policy when it comes to reimbursement, whether it's at the federal payer level or on the commercial level as well with local markets.